you know, in neurological cases, unless you understand health, you're only going to see things get worse and worse and worse. Things do not get better. Nothing stays the same in creation. You're either going down one of two pathways, to Wellville or Hellville. So remember, neurologically, we are in serious trouble. Go back to the adrenal glands sitting on top of the kidneys. They're a mess in most people, and they have a huge role to play in the control of the autonomic nervous system. That's the nervous system that deals with the movement of all things in the body. The central nervous system, the hard drive, just sits there and looks pretty and understands and sends communique. It's the autonomic that does the hard work. And that's the system that's failing most people, although now we have brain lesions and we have everything else. I was born with a degenerative neurological disease called Charcot-Marie Tooth. I've heard of that one. Excuse me. Heredity neuropathy type 2, CMT2. All right, let's stop a minute and think about it. No matter what, and again, the tendency of our society is to use the word diseases. That's a tendency that is a bad tendency. Because out of that, we have disempowered ourselves. We have put our faith and things into one modality. That modality has done everything it can to cut down our modality to nothing. It has slandered us for years like nobody's business. Given big spouting opinions on things they know nothing. And so, you know, we're back to that sort of thing. But what causes the breakdown of tissue? A neuropathy is not cells that are sitting there looking pretty. What at any time augments or breaks down or in any way affects all of this, all of the processes from oxidation to ionization to methylation to you name it. What obviously, and in research on methylation, it talks about the changes of lifestyle and stress and everything else in terms of affecting methylation and then the DNA and RNA and stuff. And it's like absolutely right. That was absolutely good research by that research team to show the understanding that chemistry affects everything. And we can use the word diseases, but it's ridiculous. It keeps you thinking that you somehow mysteriously weren't blessed by the Supreme One. Not true at all. Everything is simple here in creation. It is simply cause and effect. You are seeing nothing that is not cause and effect because it can't happen. It is physics. It rules creation as chemistry rules the lower part of creation, the physical universe. Chemistry doesn't rule the mind or emotions. These are energetic bodies, but it does rule the physical body. And so it is my big opinion that you use chemistry to get well. You use energetic forces to get well emotionally and mentally. There's so many things we can talk about those. So this neuropathy can happen when you're in mama. And when you say no demyelization, it might be interesting to pull your eyes and see if you do have nerve rings. Because the one thing we can't see in allopathy is weaknesses. And you have to understand there's strengths and there's weaknesses. Some people are strong, some people are weak, right? Well, this is true cellularly. And when the adrenals are down, which sit on top of the kidneys, and these are big glands that seem to be down in almost everybody to some extent, then you start to see the myelin sheaths going down. What point they see it, who knows? But they do not see weaknesses of cells. They do not see inflammation. They do not see acidosis. Not until it's so dehydrating and so agglomerating that you start forming tumors. Or you see calcifications. You're going to see calcifications or things that are getting hard in an acidic medium. That's just natural. So it's important to understand that this is all about acidosis no matter what rarity or whatever they say or whatever nerve or level they talk about, because they can make this so confusing. They don't even understand it, I'll have to tell you. But it's easy to understand when you go back to basic chemistry. Chemistry only has two sides to it. Your body is your physical body is a total product of chemistry. You got your cells and their genetic memories from your parents and your grandparents, blah, 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 blah. But you got your fluids, your fluid chemistry from your mom on, and your lifestyle. That's how you alter, change, or in some way affect your blood chemistry and your lymph chemistry. You know, you got to understand you've got two major fluids that control the wellness of the cells. And it's the fluids that start the problem off. Because a normal healthy cell, go back to the French physicist that kept part of a chicken's heart alive for what, 20 years? Just to give you an insight to the strength of a cell. It is once estimated by the higher thinkers, they don't know the lifespan of a cell, given two essential ingredients: proper nutrition and proper cleansing of the cell. You must understand, if you don't get rid of cellular wastes from cellular activity, those wastes burn back on the cell like urine burns back on the bottom of your baby infants. Same waste. Urine is the same cellular waste, because that's where cellular waste goes, through your urine and out, or through your skin. They don't magically just poof, disappear. They're not all ionized and brought back into base. Not even close. It has got progressively worse over the years, and I now wear orthotics. Holy crap, honey, and you use crutches to walk? That's not good. I can no longer drive, as I have no sensitivity in my feet. Oh, man, and very little in my hands. The muscles in my hands have wasted away, too. This is all under acidosis, guys. You have to understand, keep it simple. Your body is a pure product of chemistry and energy, chemistry and physics. Take a look at this. Those diseases over there in the corner, let those guys play with them all you want. Take a look at reality and what's going on in your body neurologically, but this is more than neurological. What system breaks down all the other systems? The lymph, acids. It tries not to, but it will if it's not correctly filtering through your kidneys. And this is just I would expect you to lose your muscles, and then I expect you to lose calcium, and I expect you just goes on and on and on, sweetheart. Not good. Everything's like opening bottles, writing, washing my face. Yeah, real bad. I'm a part-time artist. Oh, man. And drawing has begun to get difficult to me, as my fine motor skills are not what they used to be. My hands and feet are extremely sensitive to heat and cold, which apparently is connected to this. That's a research stress. All the research stresses that there is no way to stop or reverse the nerve damage. Well, if you go to the medical community and you ask them how I cure diseases, there's not one of them can help you. Because there is no cure literally for anything, honey. Anything. It isn't just yours, it's anything. There's no cure for high blood pressure. My God, my dog can cure high blood pressure. I mean, I don't mean to be facetious, but after a while it gets pretty sickening when you've got a huge modality that has all this money, all this pressure, that's brainwashing all the people around the world, that's a top killer of humans around the world, and people rely on that. And it's time to wake up. It's time for the medical doctors to wake up and get away from that so they're protected, and come join us where we can heal the world and you're not lost in a world that you don't understand. And you paid all that money to go to school and you still don't understand it. That's nuts. That's not good. There is total nerve regeneration, but, and I've said on many videos, and a lot of you are very aware of this, it takes the fruit, the berries, and the melons, period. Nothing else. So, sweetheart, you got to go on fruits, berries, and melons, period. Nothing else. Nothing else. Because I have regenerated the nervous system on all levels. From MS, we rarely lose. Lou Gehrig's. How about spinal cord injuries? You can do this. Neuropathies are easier than all those even. So, wouldn't you, so think about this. You're progressively getting worse. Okay, so let's think about this. What could be going on in your body to make this worse? What could be attacking your nervous system? What could be breaking it down? Is it bacteria? Nah. How about, it wouldn't be virals. What could be doing this? It's a disease. What could be doing this? Has the cell got something that no one knows about? No, it's your lymph system. It's acids. And this is tied right to your adrenals. That's where your probably your genetics are in the first place. And then to your kidneys. So you really can get this. You get your kidneys filtering. Another thing you want to take a look at, I don't know if you've been to a chiropractor yet, but have him look at the upper spine, have him look at your spine and make sure you're not compressing down on nerves and everything else. Make sure your vertebrae are all straight and nice and all that sort of thing. And head off into the detox world. Get yourself worked up to a fruit, berry, and melon diet. Upper circumbranian nerve, period, right off. Upper circumbranian nerve is what I'd be doing. I'd be sucking those babies down, because you should see a lot of testimonies on there about nerve regeneration from those formulas. At the same time, I'm going into my kidneys. I'm going to hit my adrenals, because there's the neurotransmitters for the autonomic. I'm going to get my kidneys filtering. Remember the filtration of the kidneys? You want to get your kidneys filtering, because you can get out of this, sweetheart, and I would start right now when you see this video. And if you're not already with us, you should be with us, because we'll walk you right back out of this, and then you can take this, there's no getting out of this, and put it right in their face. Because that's the trouble. If you buy in, you guys buy into there's no cure for me, you're stuck. They've just taken your joy and your life away from you for no reason, because they don't have a clue. These are rare diseases. No one has bullshit. A lot of people have neuropathies all over the place. Oh, this is a special type. You have total power, sweetheart, to back this out and to rebuild your nervous system. Total power to do this. You might want to kill some parasites while you're doing it. You know, you get on that 14-week protocol to take off on that, but I would also add brain and nerve right up front. I had it in there, but I'd write it right up front. Go after that nervous system. Start rebuilding it. Go the adrenals, of course. Go down to the autonomic, which is the worker bee. That's the one you're talking about. That's the autonomic. But you want upper circumbranian nerve, because you want to make sure your central's turned on. This is the central nervous system, worker bee, autonomic nervous system. Worker bee, two sides, parasympathetic, sympathetic, push-pull. The brain, being the central nervous system, then is connected to the body through the parasympathetic nervous system and the sympathetic nervous system. The central nervous system is just like the computer hard drive. All the information is stored, all the directional information is there. The autonomic nervous system is that nervous system that makes everything happen, makes everything move, makes you breathe, makes your heart pump. The sympathetic part is controlled by the adrenals, and the parasympathetic comes right out of the cerebellum. For those that have dizziness, equilibrium problems, things like that, it's at the cerebellum.
Brain fog?
Brain fog, all those things. Well, what about stomach problems? Because all these two nervous systems come together in the stomach. Yeah. So you can get nauseated from having pressure in the head. And when you get pressure in the back of the neck and head, that's the cerebellum. Your blood pressure can flip. You can get equilibrium problems, dizzy problems. Recently, my voice has started to be affected, and nobody can tell me why. Well, because, listen, this is the autonomic, honey. And it's all going to go down on you. You want to stop right now. You get into a full-fledged detox, and if you can't do it on your own, you need to have Marcy or me or Jennifer help you, because you can get right out of this. And it's going to take you a little while to regenerate the nervous system, but give yourself 6 months to a year to regenerate it. But you should be able to regenerate. You should have your feelings and everything back within 6 months, I think, easy. We get people walking within 6 months easy. Not everybody, but sure have a lot. The throat guy says it's because the muscles in my throat don't open and close. That's controlled neurologically, people. I work as a private teacher, so this affects my work. My voice and lost my voice. I have to make a lot of effort to speak sometimes. Here's another one, scoliosis. Apart from this, I have severe scoliosis, which I am told is a symptom. Okay, so here's what we were talking to Marcy, and I was laughing at this, because this is something I said before, you know, the medical profession tends to look at the ass end of the donkey first. And here's the reason. Take a look at this. All right, diabetes. You're a diabetic type 1, all right? So diabetes causes neuropathy. Diabetes causes gangrene. Diabetes causes, you see all these things? So the disease diabetes causes all these different things. You see the fallacy of that they're looking at the ass end of the donkey? Come back forward and look at the lymph system and acidosis causes each and every one of those, plus more. Wait, there's a lot more. Not coming from one disease. This is you have a whole system down. Hi, Dr. Morse. I have been watching your YouTube videos in hope to find an answer to my cardiac neuroses. Not necroses, neuroses. And it seems as if there is none on that topic. Oh, I thought I would help you out, Johnny Walker. Please, it is not asking too much. Make a video or include me in your question and answers. You betcha, my friend. I wonder what herbs I can take to heal this. I have been raw for 4 months straight, I think is what that is. Just fruits. It is not helping, even though I have lymph segment in my urine. Good deal. And my lymph is not that bad. Okay, so let's think about this, because this one is not necessarily the lymph system. I took a national boards one time, and it took me several years to study for it. And it was a cardiac test, national boards, and it was very involved. I had to know all about EEGs, EKGs, ultrasounds. I had to know all the cardiac meds, advanced life support. I mean, it just went on and on and on. So it was, you had to know all your rhythms, of course. You had to know how to intubate. You had to know all those things. And I have never heard of cardiac neurosis. And I think it's funny, because it's easy to understand that. You know, whenever you're dealing in any neurological or emotional event, and emotional is neurological. So whenever you're dealing with an emotional event, and you see a reflex of that emotional event, what gland would you automatically go to when you understand that, one, the central nervous system is the hard drive, and then you have the worker nervous system, which has two parts to it: parasympathetic, sympathetic. Push, pull, in, out. Breathing, everything is controlled by this autonomic. Autonomic means that it's going to help you move, breathe, heart pump, everything else. So, which nervous system do you think is involved in cardiac neurosis? That's what I thought you would say. And that is the sympathetic, parasympathetic, the autonomic. Well, now, what glands control the autonomic nervous system? And those same glands are directly responsible for emotional issues, stress issues, inferiority, all these problems we have emotionally. What two glands affect those, and what do they sit on top of? And I knew you were going to say that, because you guys are good. Definitely the adrenal gland sitting on top of the kidney. So you can have a lymphatic issue with that, but this is more a neurological issue, Johnny. And this is going right to your adrenal glands and the autonomic nervous system. And I'll tell you also, though, now think about this, guys. Where else would you look for this problem? Where is the second brain? Where is that brain of the autonomic nervous system? You're right. Stomach, solar plexus. So, this person, Johnny, could have a highly inflamed stomach, small intestine area, from what? Lymphatic constipation. Interstitial lymphatic constipation. So, this is going back to the adrenals again, the kidneys. See how we keep drawing these similar lines back? So we're back to the kidneys and adrenals again, but we also see how it affected the GI tract and the lymphatic system in the GI tract. So, and again, think about when you go after somebody, you're going always after the kidney and adrenals, always. No, not even a question. Always. What else are we always going after? The GI tract, the mouth to you know where. This whole, but we're cleaning, but we're also going after that in a unique way. How are we going after the GI tract? By going through kidneys and adrenals, the lymphatic system, interstitial. So we're going after the lymph system in the heart, in the GI tract, in the liver, in the pancreas, in the brain, aren't we? When we go after the kidneys and adrenals in the lymph system, we're going after that individual from head to toe. So we know, if we go back, that if you have a cardiac event, whether it's an emotionally tied or whatever, you're going to go to two places. You're going to go to kidney and adrenals, number one, and then you're going to go to the GI tract, number two, and you're going to get all this inflammation out of there. Because the more that you can feel your stomach, the more you can feel cardiac events tied to that. And so you're going to clean that out. Another thing, clean your lungs out as well. So you're cleaning this body out and you're rebuilding it. So all this inflammation, all the weaknesses in the nervous system. So I would think about more brain and nerve. I would think about the adrenal 400s, probably glandulars, and go into that. Definitely get my kidneys, get my lymph moving, and strengthen up that autonomic nervous system, and you'll pull away from this cardiac neuroses. I thought that was interesting, Johnny, that you brought that up, because you don't hear about that too much. Easy to understand when you understand that it's a neurological event and which nervous system deals with this and where does that event start. Adrenals, you also have the brain there at the stomach solar plexus area. So when you have a weakness, which is common to have autonomic nerve weakness, and today chronically so. So it's easy to understand, Johnny, where this is coming from. Just strengthen up that nervous system, and if you have any heart weakness itself, but getting the lymph out of the heart also, moving well out of the heart, getting the heart reduced down, getting all this inflammation out of there, of course, increases neurological events, proper neurological rhythms. My father has been diagnosed with Parkinson's, and he's 78 years old. So immediately, when Parkinson's or MS or any of these neurological compromising issues come about, immediately there's only two nervous systems. One's the central nervous system, which is the hard drive, that's the brain, and then the spinal column. Then you have the autonomic. The autonomic is where the central tells the autonomic goes okay, and everybody works. And that's autonomic makes things happen. Sympathetic, parasympathetic. Remember, the parasympathetic comes in here. The other half's tied to the adrenal glands. You'll always find adrenal gland problems. Of course, when you find adrenal gland problems, you're going to find kidney problems. And when you find kidney problems, you find what? Lymphatic problems. And when you find lymphatic problems, what do you find? Acidosis. And when you find acidosis, what do you find? The breaking down of cells. Generally, it's just inflammation and swelling. That alone can create equilibrium problems, neurological suppression, twitching, convulsions, and things like this. But when you really suppress that system, it's really more serious. You get into convulsions. We got people that seize all the time, have seizures. I have one poor soul that she says seizures, 10 a day or something now, down from 30. I mean, this is just unbelievable kind of stuff out there that these poor souls are suffering with. So immediately, before we go read any further, we know immediately that we got to go into this person. They probably got some brain lesions from all that acid buildup in the head. And so typically you see brain lesions with MS and Parkinson's. Sometimes no, but as a rule. So you're going to go up with upper circulation and brain and nerve. That's what I would be doing. And you're going to be taking care of the system that's creating this problem. You're going to go into the adrenal glands, get those up because of the autonomic response with that. You're going to start getting those kidneys cleaned out and flushed and get that lymph start moving out. That way you're going to move these acids out of these interstitial fluids. That way it'll bring down inflammation. It'll give a reprieve to the cell. If cells are already damaged, we can rebuild them, or they're going to go to lymph nodes and be dealt with by macrophages anyway. So you want to go down that line. And remember, all neurological cases require 100% fruits, berries, and melons. Don't even waste your time with salads. Maybe to get going, maybe for the first month to get going, but you want to set in. Now, this guy's 78 years old. The chances of going all fruit, berries, and melons, you got to see where his head's at. At 78 years old, a lot of people, and it's a male, so a lot of males at 78 go, you know what, I lived my life. I don't care. So you got to look at that. See what he's willing to do, because Parkinson's is gnarly. I would say try to avoid sentiment with Parkinson's and use our antispasmodics. We got the strong antispasmodic in. I would go with that to control any shaking, tremors, anything like that. But I'd hit that nervous system, hit those adrenals, get up in the brain with the upper circ. At the same time, you're going to start cleaning up this gut that the head's sitting on, and you're going to get those kidneys moving. Everything you guys know to be true in detoxification, you're going to go right after that. Why? Because detoxification takes care of the causative factors of all man's problems. Because man's problems has always been chemistry, hasn't it? His consumption, or what he's done to the atmosphere, and what that's done to the cells. And now the cells themselves are having a lot of problems, as we know. Now, he was issued antivirals and dopamine meds for the Parkinson's. He is on. Now, what's interesting about the dopamines is that dopamine controls kidney elimination. He has severe dry eyes. Okay, so right here, he has severe dry eyes. What's up with that? Extreme dehydration. So you know that the likelihood of having brain lesions are high in a person like this, even though we haven't covered that, because of dry eyes. And he's working for macular degeneration and, retina detachments and all these sort of things like this, because dryness means dehydration, means acidosis, means that your lymph system isn't being filtered properly through your kidneys, which means your kidneys and adrenals are in a problem, which is classic for humans. Humans on planet Earth are classically kidney and adrenals, which leads to massive lymphatic problems. And that's what you're seeing. And kidney failure is right along up there with everything else. Sleep apnea, obviously, is very congested lymphatically. So he needs to clean it up. Get this, psoriasis on the neck and face, highly acidic on the face and neck, of course. Why wouldn't you be? You have dry eyes, you have Parkinson's, which probably comes with some brain lesions on that. The dandruff, that's classic lymph moving out the skin, dandruff, lymph. So this just confirms all these symptoms that he's having. Gary is confirming to you how acidic your father is. And he has to, maybe he'll review this video, but this is serious, because that's the first step to Alzheimer's, dementia, things like this as well. All this high acidosis and stuff in the body. He was sent to a psychiatrist for depression. Okay, now we're getting at some things too. Depression, why are we coming in here? He's losing a lot of calcium to all this acidosis. What's he not doing? Obviously, depression, parathyroid gland. But look, he's got psoriasis in the neck. Why wouldn't his thyroid also be saturated? He'd be lucky not to have some nodules growing in the thyroid. Very classical for lymph stagnation, and that's just what you're seeing here. So he's issued antidepressants, which is as worse as depression. We got a great new depression formula, but at the same time, work on his parathyroid. He's going to need it to rebuild tissue in the nervous system. And there's another case of looking at why his nervous system is down, is his parathyroid's down. So you've got to get that up. You really got to get the lymph draining out of his head. Well, it sits right on top of his bowels, and then there's the kidneys. So you got some work to do down below before we get up to the top. He's doing physical therapy for Parkinson's and speech therapy. The problem with this is you're making activity where rest needs to be more considered, and let the magic of magnetic chemistry come in and fix. There's a time to and a time not to. You can get the speech back, you can get all that back. But they're not doing it, they're just giving him therapy on top of everything else he's doing. Bad diets, body's highly acidic. You got to correct these things in people and then do speech or physical therapies. But you've got to be in the process of getting the person well for these to have a lasting and an improvement that's lasting. Can you please explain why Parkinson's is happening and how it's happening and what he can... Yeah, exactly, just what I said. And thank you so much, my friend, GW. Very important case, 78, so he's got to be willing to want to be well in his life at 78. And then by the time he fixes this, probably he'll be almost 80, say at least a year and a half. It'll take him to do this. He might be a strong old boy and come out of this a lot quicker. My wife has a friend that has MS in a wheelchair.
Could you explain better what typically goes wrong when people end up with MS and discuss in more depth the areas you focus on with MS? I am going to forward that other video to her. Good. I think she needs to see this. I think she has pursued some sort of stem cell therapy, but I think she is really interested in natural healing. Excuse me here. Okay. Well, we were talking to an MS case yesterday, and this is a broad span. You can lump a lot of neurologicals in this, from Lou Gehrig's to MS to even maybe Parkinson's, all in this broad span. You've got brain lesions and you don't. Brain lesions can be any kind, frontal, anywhere. A brain lesion can start out as a genetic weakness in tissue and then exacerbated with acidosis, where the acids just break down these tissues. These are not difficult to regenerate, but you have to first understand that what breaks things down is the acids of the world. Acids are corrosive, and your body produces acids as 1, cellular byproducts, 2, parasitic byproducts. We just talked about uric acid and the byproduct of fungus, the fungal community. So there is a lot of acids produced internally. Just moving your muscles creates uric acid or lactic acid. So you have a lot of acids, phosphoric acids, carbonic acid. There's just a lot of acids that are created that are not all converted back to base, but must be eliminated out of the body. You can't run acids in the blood, so you have to have a distinct separate system. So when the lymph system backs up in the brain, it can affect the cerebellum. When the cerebellum's involved in a neurological case, you see the equilibrium problems, the dizziness, the equilibrium, the vertigo problems. It can also connect it to other parts of the brain, but cerebellum is oftentimes involved. Also, you see the autonomic, not just the central nervous system, you see the autonomic. The autonomic is your limbs, your legs, your ability to move. That is your adrenal glands. You'll find low blood pressure. Adrenal glands is a recharging battery for the autonomic. The neurotransmitters are the recharging units. Low adrenals, if they're real weak, your blood pressure can drop down into the 70s, 80s, 90s. You don't hold a charge. You get fatigued a lot. Your adrenals are like a battery charger. They're recharged. If you consider the human body an alkaline rechargeable batteries, the nervous system and the adrenals the recharging unit, you'll see that the neurological conditions like MS in particular, but Lou Gehrig's and Parkinson's, they don't hold charges long. And anything that takes out their charge makes them weaker, like hot, heat, acids. They're really highly acidic. So when you add more acids to the mix, then they have more problems. They lose their ears, they lose their breathing. And this shows you the neurological connection to acidosis. And the adrenals are the recharging units there, and so you got to get the adrenals up. That's why you're exhausted. The more the adrenals are charging the autonomic, the longer you can go. And there's a time where the adrenals just are continuous charging. You just don't get tired. You can go run for 5 miles and stop because you're bored. I missed that. I had that at one time as a fruitarian. As I've slipped down off of that, I don't have the same levels like that. I have boundless, endless energy, but more than my body can tolerate. That's what happened to me. I had to step back. I was pumping too much energy into a body that couldn't handle it. Now, some of you, we've already talked with some of you about that. Dan the man as well. You get too high of energy. Some people don't understand that. You've got to back down. Got to back down or you'll get out of balance. And you don't want to get out of balance, because then if you're not aware that you're getting out of balance, you're going to lose some friends and not influence a lot of them. So you really, walking in balance keeps your life in harmony with everything around you. I do push you out of balance, though, to get you to detoxify deeper, but just keep these little things in mind when you're hearing these things, and you'll see what I mean when you get there. Worms can also, excessive parasitic action on the body can deplete neural energy, and therefore you can have a lot of nerve responses neurologically. Toxic chemicals or metals like aluminum and mercury, they love the brain, sets up inflammation. Any acid sets up the immune response, breaks down tissue. So detoxification is always at the core of any problem, including and especially all your neurologicals. It's just that if you have neurological damage or nerve damage or weakened myelin sheaths, the fruit is at the top of regeneration neurologically. If you want to argue vegetables are better bone and muscle, okay, but neurological brain, vegetables will get you nowhere, and I've discussed cases before in these videos about putting people that I've gotten walking on fruits back on vegetables, and they lost their ability to walk. And I've discussed why. I'm not going to do that again here. It deals with the magnetic energy of fruits, and what magnetic energy is to a neurological case is everything. Energy is everything to the nervous system, and when the nervous system isn't getting the neurotransmitters, serotonins, or you're breaking down brain tissue, you're going to have a problem and you're going to feel it. Now, herbal-wise, not only are you going after the lymph system with the kidneys and the lymphs, and you're going after the GI tract, and you're going after that way. You're going to kill the worms and the parasites and the flukes and all the crap in people that way. Yes, yes, yes. Upper circ, brain, and nerve. Those two formulas I made specifically for all neurological cases, including spinal cord injuries. So I like those two formulas, upper circ and brain and nerve. Upper circuit, I discussed this I think yesterday about the upper circulation shoves blood into the brain, oxygen into the brain, but the brain and nerve helps regenerate brain tissue and regenerate and strengthen neurons. And so very important that those two things exist with a high fruit diet, and she'll get out of that chair. That video is a lady that was chair ridden. So I can just tell you, and brain lesions will rebuild. I've never had a case you couldn't regenerate the brain tissue. I never had a case you couldn't repair brain lesions. I never had a case like that. Unless they stopped and without going through it and didn't tell me. So that's what you got to do. So she wants to get out of the chair, she can, but she's got to grab the bull by the horns. This is truly wearing the robe syndrome. When you're down that far, you've got to wear the robe and really get this. She needs to review all these videos, capture this, grab this, and wear it, and she'll get herself well again. Don't sit around. Even if you have minor MS symptoms, don't wait. Don't wait until you can't walk like this poor lady. And we have a ton of them coming in here, wheelchairs, canes, or on stretchers. So you don't have to go that far. The further you take your body down, the harder it is to get back. So, don't go down too far. One case, the ambulance brought her here, and she was an advanced MS case. And she was prone, stiff, flat on a stretcher. Couldn't turn her head to say, "Hi, Robert," stiff as a board. Oh, I'm only about that thick. And so I put her all on fruit. And 2 months later, she could wheel herself in the wheelchair, and she could feed herself, sit up, all those things. So I wanted to put more muscle on her because she was so thin. And generally speaking, I raised horses growing up, and we used alfalfa for muscles. I knew Ann Wigmore, and I asked her, "Why did you pick wheat?" Alfalfa is a superior plant, and Shackley knew that. Alfalfa is an incredible plant, particularly for muscle building. Minerals, things like that. So I put her on a green drink, and I put her on a salad. And you know what happened to her? She couldn't move anymore. She went back to being an invalid. So I put her back on fruit. And you have to understand the power and the magnetics fruit has to turn on the body's nervous system, especially Homo sapiens nervous systems. I was watching this thing about amyloid plaque in the brain, and it was having a commercial on Alzheimer's. Everybody calls it Alzheimer's, and I'm looking at that and saying, there's no T in there, there's no time in there. It's Alzheimer's. So you've got amyloid plaque. What you've got is the same thing you've got in everywhere else. You've got proteins or acids building up around a cell, which causes inflammation. Then you've got the mucus, and you've got all the lymph response to those, and that's what you see. So how do you get rid of plaque? There's only one way: detoxification. Elderly parents who are showing early signs of Alzheimer's. Okay, berries, melons, and grapes. When you're older, in particular, your diet must be simpler, because of the digestion, because of the teeth. You want to make it simple. But, how about the brain and nerve? What about the brain and nerve? What about the endocrine glands? If someone's older, don't you think we want to have more food for brain and nerve power? We want more food to keep the glands up and supported? Don't we want to keep their lymph systems moving so they don't get rigid and stiff and full of pain? Fruits, berries, and melons every time. Maybe a salad at the end of the day, or get some green drinks if you don't have the teeth. Alzheimer's, very important with Alzheimer's, guys. You want to get up in that brain. You want to move lymph. You want to use upper circulation, sweetheart, on your parents, and brain and nerve, especially my new brain and nerve. Really turn on everything, get blood flow, but it's equally as important as moving blood up in these tissues, you want to move lymph. And also address the adrenal glands, of course, for neurotransmitters. That'll help the brain too. And you really just kind of turn on their bodies again. Keep digestion simple in them. But you want to power up that nervous system, power up that brain. Well, proteins don't do it. Starches don't do it. Fats don't do it. But fruits, berries, and melons do. You see Alzheimer's and dementia, particularly in those that use a lot of pharmaceuticals that never get any sun and their lymph systems are real bad. Always see that. They don't get sun, they don't go out, they don't work outdoors, they don't sweat. These are the people that hire maids for their work and everything else and don't do anything themselves. We see this all the time. About how long would it take for someone with Alzheimer's to heal? Yeah, you're probably going to give them at least a year, if not 2 years. I'll be honest with you. Depends on the person, how you can get to them. If they eat, can you control totally their diets? Can you give them herbs? Are they in nursing homes? Or how far advanced are they? All these are factors. If you're in nursing homes, can you get to them? Can you get the meals to them? Can you get the herbs to them? All these are factors. But give yourself at least a year, because you're talking about chronic, if not degenerative, CNS problems, and also I might add ANS problems. It says, what about healing seizures? Have you ever helped anyone heal their epilepsy? How many? But, we have some tough cases, and I think I've told you about the poor a young girl that's 26. She's been seizing since her first vaccination back when she was only in the months old. And she was having, 30 seizures a week or something, 50 or more. I mean, this is insane stuff. Holy crap. And this case has been hard for me to get her back into Wellville. Her seizures are way down, but it's still tough. This girl could be another year or more doing this. I mean, this is just sad stuff. Let me tell you. We are being born with weak adrenal glands, which translates into low neurotransmitters, which translates into weakened myelin sheaths. Check your nerve rings in the eyes, right? So those with herpes are getting a lot of shingles, and now you're seeing all the advertisement for shingles. But the worst case scenario is we're subjecting them to vaccinations. This world, I was telling you about a chemist that was in here a year ago or something. We were laughing about it, but he's saying there's about 2,000 known neurotoxins. Neurotoxins are those things that suppress the nervous system. And vaccination, thimerosal, was known as a major neurotoxin. Oh, but it's okay. Pharmaceutical companies, it's okay. You're privileged. You're allowed to have these on the market. So you have all these neurotoxins, and if you're right at that level. Now add to this the amount of parathyroid weakness we're also facing. We're facing extreme endocrine gland weaknesses from the pituitary down. And you guys are learning a lot about that, and blessed to you all. But take a case where you have a parathyroid weakness, all right? So you're not utilizing calcium well. Take out too much calcium and you'll start trembling. You'll start seizing. Also magnesium and manganese. There are these other factors. That's going back to the adrenal glands and the utilization of your other chemistry, steroids. So you have a steroid connection to mineral utilization. You have a neurotransmitter connection to the myelin sheaths. You have all this, the extreme low blood pressures. So little things like neurotoxins, surgeries, propofol, and all these things are creating deaths, the stop breathing syndromes, and the seizures and epilepsies. And of course, then with that, you're getting all the other central nervous system issues from the GI tract is so bad. Remember all the tumors that are up here, the brain lesions everywhere. So one remedy, and you guys know it. You get into that body and you start cleaning out these acids. You start bringing up these adrenals so you have better steroids. Clean the bowel walls and get in interstitially where you're getting absorption of nutrients. Then you got with the adrenals the utilization of nutrients. You get the parathyroid up where you got the utilization of calcium. You get the neurotransmitters up where you're rebuilding the myelin sheaths. Me, myself, and I like antispasmodics, herbal, to help with the seizures. Spasms, whatever you're dealing with, tremors, Bell's palsy, that. I like brain and nerve, number 1 or 2, particularly number 2. I like upper circulation to get blood moving more aggressively to brain tissue. And then I like getting the kidneys filtering and getting these acids out. And when you do those things, you will be successful with all cases from epilepsy to MS to Bell's palsy to you name it. Spinal cord injuries, all these things are relative to just what we talked about with that case. And you do those things, and you'll be very successful. Always have been. Always have been. Anything for cerebral palsy, absolutely. So you do upper circuit, brain, and nerve, wouldn't you? But what else would you do? You'd really hit the lymph system again. You're going after causative factors. You're going after acidosis. You're going after the lymph system. If you want to clean the liver, the spleen, and all the body, go ahead. That's going to be the process there. But when you're cleaning lymph, you're reaching everywhere. If you want to clean the blood, we got a good blood formula. But when you're dealing in any type of neurological problem, you're going to go in upper circuit, brain, and nerve always. Great takes for those, and you're always going to move lymph. That is sufficient. When you start getting into more cerebral areas or into spinal cord injuries or MS and Lou Gehrig's, Parkinson's, that's going to be 100% raw. That's going to be almost 100% fruits, berries, and melons. You want to get away from the vegetables. You really do. I mean, you can do some greens, green drinks initially and some salads, but work yourself into a predominantly fruitarian lifestyle for a few months and get this, get these neurological conditions regenerated there. Definitely, anything like that, anything. From the Bell's palsies to the cerebral palsies to the Alzheimer's, dementias. You can start getting too deep into the Alzheimer's and into the dementias. They're much more difficult, particularly when you're working on those people that have them, because it's really hard to deal with a person that is at these higher advanced levels of Alzheimer's. You're talking about autism here, and do you think that AS should be cured? I don't think I've ever had a case where I couldn't pull them off the ceiling. Everything. And let's take it out of the realm of diseases, and let's take it in the realm of neurological weakness, exacerbated by neurotoxins. Definitely. We're going right back. When you work in the body and you work in the adrenals, you're working in the autonomic, but you can also get up here with upper circuit, brain, and nerve, and you can affect some tremendous regeneration in the central nervous system. And this is all about simply cells and two major fluids. And I don't care if we're talking about nervous systems, we're talking about livers, we're talking about hearts or pancreases. It's just that when you get to the nervous system, that is the carte blanche of them all. That is the electrical part of the body. It does not deal well with cooked foods. It deals no well at all with meats or dairy products. The only true nerve regenerating foods are the fruits, the berries, and the melons. I've had a lot of experience with neurological cases. And I think I've mentioned a couple where I've taken a C3, C4 quad, totally regenerated her after 12 years down. We had a lot of cases of autism. And we get a lot of cases where the parents tell us, and the children, where they noticed it only after vaccination. But the problem is, it wasn't the vaccination. That was just a neurotoxic plug. That definitely exacerbated the underlying problem, which is the weakness of the autonomic and maybe even in the central. Are there any genetic weaknesses in the body, such as autism or cerebral palsy, etc., that can be made better through this protocol but not healed? Well, I will say that I've had some very tough cases in autism. I've had a lot of autism around the world come in here. I've not seen one we hadn't gave massive improvements, if not, got through that process. But in reality, there's always going to be someone out there that can't do completely or stay on, and yeah, you're going to have some hard times, and they're going to have some remnants of stuff, absolutely. They're just not going to get every young child turned around, neurologically rebuilt, adrenals, kidneys, and all that, just because of the nature of the parents and the nature of the kids and everything else. So you have all that to consider, the peer pressures, the schools. The schools are a big pain in the butt. Not only do they just teach academic, they don't understand how to teach the other side of that. Plus, at the same time, the school lunches are just horrid. Could you talk about shingles? Absolutely. What to do during shingles, what one should eat and also avoid, what herbal formulas you recommend during shingles. Okay. You remember we talked about the strong survive, the weak are consumed. You see that everywhere in nature. You know it's a fact of life here on this planet. But it's an essential fact of life, and you have to be emotionally detached from that and look at it from the perspective of the broader picture. To sustain a biosphere that sustains untold amount of species, you can't reproduce your weaknesses. You must consistently reproduce strengths and eliminate the weaknesses. And we haven't learned that with Homo sapiens, and I've had a lot of conversations about that. You have to take the emotional component out of this. This is why it's important for those spiritual people that understand that life is conscious, more soul, more awareness, way beyond this little realm of matter and material bodies. So when we produce a material body for a soul to use, it is still just a material body. So sometimes they're so mutated, we need to drop them and let that soul go on and grab a healthier body. For some, that's a shocker. But it's nature, it's God, not me. But you can understand why that exists, and that's also important in your body at the cellular level. That's what your immune system's for. That's what virals are for. Virals are one way of cleaning the weak out of the body, if you can stand it. The biggest problem is that we've become systemically weak. So some people can really get chewed on real bad. So some of our game here is going to be to try to strengthen and detox and do all this stuff together. But with that said, shingles is nothing but herpes on the nervous system, herpes on the myelin sheath, which is the coating of the nerves. So this is just a viral attachment. A viral attachment. Virals are proteins. So guess what medium you don't want to be in? Acid protein medium. That always brings herpes out. Notice it, like pineapple or anything too acidic. If you eat too much protein, you'll start getting these little simplex sores. You can be genital, it can be in the mouth. I don't care. Location, location, location. Still a viral, still attaches to weak cells. And proteins, of course, acidify the body and bring out that. You'll notice that when you're eating alkaline, a lot of times these will go dormant. Get your body acidic and they come right out. And if you do too many acid fruits, they'll come out too, because that's acid clashing with acid. Even though fruits, most of them have a base chemistry reaction. So, two things. You want to strengthen up the adrenal glands, which in turn will bring up the neurotransmitters, which in turn strengthens the myelin sheaths in the nervous system. Using the new brain and nerve formula is a good help with that. Getting up, cleaning out the brain, cleaning the lymph. It always comes back to cleaning out your lymphatic system, which is where the acids are, and getting away from proteins. You never want to eat proteins or heavy amino acids in the presence or where you have herpes involvements, because you're going to always fight them. They are acid proteolytic virals. You just really want to get away from the acid side. But this is what we're all struggling to do anyway, is get away from the acid side of life. And so some of the things you have to do is make strong that which is weak. And when you ask what weakens things, it's always going to go back to the lymph system, acids, and that side of chemistry. And protein is going to fall on that side of chemistry, like it or not. You can go back and say, man's been eating meat for millions of years. Stop and take a look at the health of men. Just stop and take a look around. And that's for you too, Centron. Stop and take a look around. What you do not see robustly healthy people eating an omnivorish diet and eggs and meat, you don't see healthy people doing that. I don't care what these people claim. Just look around. How many people are sick? 21-year-old male patient with mental problems. Could be schizophrenia-like symptoms which showed up rapidly over the past 2 to 3 months. However, first signs of depression and withdrawal have been noticed earlier, around 3 years ago. All right, so let's look at this. You know, one of the big things when you're looking at mental disorders, if we can lump that, I just hate that word because, you know, some things are actually chemical process problems as opposed to mental health. You know what I'm saying? It's not the mind, it's actually chemical processes. So, always upper circuit brain and nerve when you have these sort of problems, because the brain and nerve formula, I have everything in there from gotu-kola to skull cap. These are some of the best herbs for the nervous system for strengthening. But wait a minute, we have many parts to this. It's not always neurological. We also have to think of some other avenues. Depression, parathyroid, low calcium utilization, fungus. Too much fungus in the body can lead to depression and unhappiness. Dealing with sugars and low energy. Adrenal glands, for sure, because that's what leads into excessive fungal growth, is incomplete metabolism of sugars. And that's going to take you to the adrenal glands. Low energy, autonomic, big deal there. So parathyroid, adrenal glands, these glands have to be up functioning properly to feel good. You have to have the parasites out of the body pretty clean to feel good. You know, the liver, the liver's always the seat of anger. When you see someone that's angry, it's always their liver. Get in there, clean out the liver, and get that part cleaned up. So know that. You remember the flower essence, moonshine, yarrow, there's a whole bunch of them. Use the flower essences for this individual because it just makes you feel good and it helps while you're in the process of being well. Would I go after the adrenals? Would I go after upper circuit brain and nerve? Absolutely. Would I be deparasiting the person? Absolutely. I'd get into the kidneys. I would start getting them up and feeling good, touching the higher levels of consciousness and getting all the endocrine glands up, the thyroid, the parathyroid, the I love myself glands, and working on those. And that'll help pull this individual out of this problem. When you see things starting to build like that rapidly, then you know chemistry's involved in this, and that it's a type of chemistry that's multiplying. Well, you have to look around to see if you're involved in neurotoxins around your house or any toxicity like that. You have to rule all those out in your car, wherever. You have to look around and see in your place of work. You have to look all around to see if you're breathing something or that you're ingesting chemistry that's rapidly breaking you down. That's number one. Number two, you know that acids are the side of chemistry that plays that role the best. So you know that the potential of this, of course, being the lymph system is quite high, right? So you know that things that are manifesting in a faster manner means that your lymph system is probably breaking down the endocrine glands faster and faster and faster, swelling up tissue, depressing tissue, things like that. As you can imagine, in such cases, cooperation with the patient is rather difficult. Well, that's the number one problem. That's the number one problem that we have is compliance and working with those people. And this is also true, I hate to say, with dementia and Alzheimer's because they can't remember. And I have a lot of Alzheimer's clients that without family intervention, it's really tough. And then even with family intervention, the level of Alzheimer's can get real bad. And it's like, oh, God, it's getting compliant with that. I would suggest brain and nerve formula on top of fruits, and I'm wondering what would you add to that, especially with regards to cooperation with patients. Greg? Much love to you, my friend. Slap them around, tie them to a chair, and force feed them. Or put a feeding tube in them. I don't know. You know, this is part of the problem in the catch-22s because you're only responsible for yourself. And it's not an ego thing and not a selfish thing, but trying to get into another person's journey and changing it and affecting it, karmic maybe sometimes, and difficult. That person has to say, here, help me. You want to make sure that person's kind of knocking on the door, unless you drop some Johnny Appleseed stuff, but you want to make sure that person is knocking on your door and asking for help, you know, and really needs it, because I tell you, some of these mental cases that have these bipolar and schizophrenia can be fixed up so easy, but hard to get compliance. So really tough. You know, I don't know. I've worked on so many cases. I don't have time to go over them right now. But you know, you can only go so far with some people. It's just some people. I think I told you that the dentist's son who loved to eat out of trash cans and sleep on park benches. And, you know, we got him healthy and happy and got him out of bipolar and everything else. But he loved to eat out of trash cans. And I said, I'm done. I can't get you any better than I've got you. See ya. Because that's it. You know, you can only take a person so far, and then don't tear yourself apart with this. You can only help people so far. You know, you can only give the love and so much. Divine love you will always have from me. Always. Now, how interesting is it that we have to get up on a high fruit diet, particularly neurological? I have I probably am the most experienced in neurological regeneration on the planet, and I can tell you, flat out, vegetables do not work. So you really have to get into these fruit levels, and you'll find that these higher levels are healing. Well, if we have to visit these high levels to heal, why can't we live at these high levels? Good question.